Trandolapril is a medication that is used to treat high blood pressure. By lowering high blood pressure, it can help prevent strokes, heart attacks, and kidney problems. This medication is also used to treat heart failure and improve survival after a heart attack. Trandolapril is classified as an ACE inhibitor and works by relaxing blood vessels, which allows blood to flow more easily. It is important to take this medication as directed by your doctor. The typical starting dose for treating high blood pressure is 1 milligram once a day. The best time to take this medication is typically in the morning. Be sure to follow your doctor's instructions for the best results. Before starting Trandolapril, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take this medication with or without food as directed by your doctor, typically once or twice a day. The dosage will depend on your medical condition and how you respond to the treatment. To reduce the risk of side effects, your doctor may start you on a low dose and gradually increase it. It's important to follow your doctor's instructions carefully. Take this medication regularly to get the most benefit from it. Try to take it at the same time every day to help you remember. Even if you start feeling better, keep taking the medication. Most people with high blood pressure don't feel sick. For high blood pressure, it may take about 1 week to feel the full benefit of this drug. For heart failure, it may take several weeks to months to feel the full benefit. If your condition doesn't improve or it gets worse, make sure to inform your doctor. As your body adjusts to Trandolapril, you may experience dizziness, lightheadedness, tiredness, or a dry cough. If these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. However, contact your doctor immediately if you experience symptoms of high potassium levels in the blood, fainting, or signs of kidney problems such as a change in the amount of urine. Trandolapril may be used to prevent or treat kidney problems, but it can also rarely cause or worsen kidney problems. Your doctor will monitor your kidney function while you are taking this medication. If you notice any signs of kidney problems, notify your doctor immediately. In rare cases, this drug may cause serious liver disease. Seek medical help if you experience symptoms of liver damage such as nausea, vomiting, loss of appetite, abdominal pain, yellowing of the eyes or skin, or dark urine. Although rare, a serious allergic reaction to Trandolapril may occur. Seek medical help if you notice symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. Contact your doctor or pharmacist if you experience any other effects not listed above. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report side effects to Health Canada at 1-866-234-2345. Trandolapril should not be used during pregnancy as it can cause serious harm to an unborn baby. It is important to use reliable forms of birth control while taking this medication to prevent pregnancy. If you are planning to become pregnant or think you may be pregnant, it is important to consult your doctor immediately. Before taking Trandolapril, make sure to let your doctor know if you are allergic to it or other ACE inhibitors, or if you have any other allergies. Also, inform your doctor about your medical history, especially if you have a history of allergic reactions, blood filtering procedures, high potassium levels, or liver disease. When taking this medication, be cautious as it may cause dizziness. Avoid alcohol or marijuana, as they can increase this effect. It's important to avoid activities that require alertness until you can do them safely. Additionally, too much sweating, diarrhea, or vomiting can increase the risk of dehydration and lightheadedness, so make sure to stay hydrated and report prolonged diarrhea or vomiting to your doctor. Trandolapril may also increase your potassium levels, so consult your doctor before using potassium supplements or salt substitutes that contain potassium. Before undergoing surgery, inform your doctor about all the medications and herbal products you are using. If you are an older adult, you may be more sensitive to the side effects of this drug, especially dizziness and high potassium levels. If you are pregnant or planning to become pregnant, talk to your doctor about the risks and benefits of using Trandolapril, as it may harm an unborn baby. It is unknown if Trandolapril passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Trandolapril, as they may change how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Trandolapril include aliskiren, gold injections, lithium, sacubitril, certain drugs that weaken the immune system/increase the risk of infection, and drugs that may increase the level of potassium in the blood. It's important to also be cautious with products that could raise your blood pressure or worsen your heart failure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen/naproxen. Additionally, if you are getting injections for bee/wasp sting allergy, desensitization, while taking Trandolapril, a very serious reaction may occur. It's crucial to inform all your doctors about the medicines you are using. Always talk to your doctor or pharmacist about potential drug interactions and how to use products safely while taking Trandolapril. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center immediately. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include an unusually fast or slow heartbeat, severe dizziness, or fainting. It's important to seek medical help right away in these situations. It's important not to share Trandolapril with others. To help Trandolapril work effectively, consider making lifestyle changes such as exercising, quitting smoking, and following a low cholesterol/low-fat diet. It's best to consult your doctor for more information. While taking Trandolapril, it's essential to have regular lab and/or medical tests to monitor kidney function and potassium levels. Make sure to attend all medical and lab appointments and consult your doctor for more details. Keep track of your blood pressure and heart rate regularly while taking Trandolapril. You can learn how to check these at home and share the results with your doctor for proper monitoring. If you forget to take a dose of Trandolapril, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to store Trandolapril at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When you no longer need Trandolapril or it has expired, be sure to properly discard it. You can consult with your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.